It's my special pleasure to welcome Professor Olivier Michielin. He is the director of the Department Medical Oncology in Geneva. Very welcome, Olivier. Again, so my first question is, of course, always the same. Why are you still traveling to Chicago and take all these difficult tasks on you?
Yeah, it's true. It's a trip to come to Chicago, but I think it's always worth it. First, there are some really important new data being presented in our fields, but it's also a fantastic environment for discussions, for basically trying to engage with some people on new projects. So I think there is really the two sides. That's the quality of the science and the clinical data being presented, but also the opportunities to liaise with our colleagues, and everyone is here, so that's really the place to be.
Perfect. What are the highlights in melanoma this year? And there are a lot of highlights this year.
Yeah, the sky has changed color today. We really had an amazing session with Christian Blanc presenting the results of the NADINA trial. It's a phase 3 trial comparing neoadjuvant to adjuvant in melanoma. And we all suspected that the trial would be somewhat positive, but the magnitude of the benefit is incredible. We have a hazard ratio for event-free survival of 0.32. This is 0.38, but this is really extremely important data. This is going to be practice-changing. This was in the plenary, and I think we will adopt this regimen, ipi/nivo 2 cycles, and then for most patients, no need of subsequent adjuvant therapy for about 60% of the patients. So this is a revolution in melanoma, and this is really showing the path forward, where we believe we're going to rely less and less on surgery, but also less and less on heavy and long adjuvant treatment. So I think it's really a new era that opens, and kudos to Christian and also Georgina Long for this fantastic work. This was a plenary discussion and a New England Journal of Medicine paper that came out simultaneously.
If you go back to your clinic and you want to start this neoadjuvant treatment with ipi and nivo, what are the biggest hurdle you expect?
So this has been an intense subject of discussion among the melanoma specialists. Clearly, we will have to discuss with our local authorities. We hope that BMS will actually adapt the label for ipi/nivo so that this can be done in a proper way. So clearly, I think there is work to be done so that we can actually offer that to patients. But again, seeing the magnitude of the benefit, I think we really have to hurry to make this a reality for our patients.
What are the most disappointing results, what you have seen this year in melanoma or other skin cancers?
Well, I think there has been a lot of attempts to try to resurrect the immune response after PD-1 failure. And so the PD-1 plus other compounds on PD-1 failed patients have been tested with a lot of different strategies, and we start to have a little bit of activity, but it's disappointing because we don't have yet a very clear picture on how we can remobilize the immune system once PD-1 has failed. So I think that's the more the darker side of this ASCO this year. But nevertheless, I believe we have some hints, and there are some strategy that appears to be promising for the future after PD-1 failure.
What are the most important aspects or tasks we have to address in the future, or what are the future questions, and where do we go from here?
So I think clearly being able to propose something to patients that have failed PD-1 is a top priority. I think de-escalation is also an important aspect. We all talk about neoadjuvant and the revolution of the NADINA trial being presented, but we have to remember in Switzerland in particular, we have excellent doctors and excellent dermatologists, and the number of palpable nodes that are the patient population that are entering actually this trial and these strategies are very limited. And so we still need to make progress on the adjuvant side. And we have had this morning the confirmation of the RNA vaccine and the strong efficacy compared to pembrolizumab single agent. So I think these are areas where I think we're going to improve the situation for our patient quite dramatically as well.
Thank you very much, Olivier, for this short interview, and I hope you have a good rest of the Congress and a safe travel back home.
Thank you, Roger.